Are you interested in knowing what coronavirus is? Are you looking to know what are the symptoms and preventive measures? Do you want to be updated on this current topic? Here, in this channel, we will inform you of this situation worldwide. Welcome to my Health and Nature channel. Today we will discuss a special topic that interests you. What is coronavirus? Symptoms of coronavirus. Please, to like the video, subscribe to the channel and activate the bell to receive more information. Coronavirus. What is coronavirus? Symptoms of coronavirus. I will give you lots of information about coronavirus. These are symptoms, how it spreads, how you can try to prevent it, and also talk about the use of the surgical masks, they really work, and load much more. So coronaviruses are a large family of viruses that cause a variety of diseases that start from a cold, which we have pretty much had right up to more serious ones having SARS. Now, this coronavirus is what we call a novel coronavirus. So it is a new strain that we have never seen in humans until the coronaviruses are zoonotic. This means that they are transmitted between animals and humans. However, there are several coronaviruses that only infect animals, but if they infect humans. For example, the new coronavirus we are dealing with right now. This is what we call a spillover event. Before we continue, keep in mind that this is a situation in development and every day we learn more about coronavirus. So all the information I give you in this video is relevant and of today on this day right now. But as the scientific community learns more, we learn too. However, this data can change over time, as I just explained. So what I want to do is leave some really useful links from WHO and the NHS is all about coronaviruses, and these sites are constant up to date. So I would highly recommend that everyone check them out. So what are the symptoms of coronavirus? Well, it can include any of the following: fever, a runny nose, a dry cough, and sore throat, and then it can lead to shortness of breath, and in some severe cases patients need hospital treatment. So how difficult is it? It really depends on the moment. We know that 1 in 5 cases can get serious, which can lead to things like pneumonia or acute respiratory syndrome. Leaves some mechanical ventilation, and in some cases, it can even cause death now. We currently know that the new coronavirus has a 2% mortality rate. This means that 2% of people who have had the new coronavirus, unfortunately, it died of it, which also means that 98% of people who have had the new coronavirus have gotten better, which is much less than that. Say for example, SARS that has a mortality rate of 10%, or even Ebola that has a mortality rate of 70%. Now it is important to remember that this is based on the current information that we have. There are currently people in the hospital receiving coronavirus treatment. So the number can change, and it is not an absolute certainty now in terms of treatments. Unfortunately, there is currently no treatment for the coronavirus. However, the symptoms can be treated. So each patient is looked at individually. Depending on their symptoms, they will also have different treatments for it. Another good news is that they are currently working on a vaccine against coronavirus. Is any traveler returning from Wuhan, China or from Hubei province in the last 14 days to stay at home? Stay indoors and avoid contact with other people. And contact your doctor and tell them about your recent trip to China. If you have symptoms of coronavirus that we have talked about before, such as fever, sore throat, briefly avoid other people, staying indoors, and contact your doctor's surgery for advice. Don't go in, just call them. This also applies to anyone returning from any part of China except Hong Kong and Macau. There is currently no vaccine or specific treatment for this virus. Disease, it can vary from mild to serious. Based on what we know right now, most cases serious have been in people who are of legal age or who have other conditions medical. Here are some things that we recommend to the public to do right now. Talk to your medicated service provider if you have recently traveled to Wuhan, China and feel sick with symptoms such as fever, cough or lack of encouragement. Call in advance and inform the medical service provider of your travel story. Avoid all non-essential trips to China. Pay attention to the news to be attentive to the evolution of the situation. Take the same precautions you would take to prevent contracting or spreading the cold or the flu. Wash your hands frequently with water and soap for at least 20 seconds, cover your cough, stay at home when he is sick. This situation is evolving, information may change. Let's share information, when available, with the public and medical service providers. You must be home for at least 14 days. And that means you won't have to work. Don't go to school, don't go to public places. And of course, if you need food, contact friends or family or delivery drivers to bring it to your house now. This is the current guidance of the world's medical bodies. However, that may change tomorrow. That may change this week. That may change next month. So the best for you. You are an amazing person. Wow. You came to the very end of this video. Can you do us a favor and subscribe and activate the bell at the very least? It would be very appreciated from the bottom of our hearts. Also, if it's possible, like, share and comment. Thanks you.